Hey gang, I'm Dr. Jesse Riley. I'm the main therapist and owner of Modern Movement Clinic here in the Denver and Golden area. Just wanted to hop on here and talk a little bit about low back pain. If you're like me, or maybe some of your friends in your social circle, you may have dealt with low back pain before. I would say you're in good company because stats show about roughly 80% of people experience low back pain sometime in their life. I would say that's even on the conservative side. The good news is that the overwhelming majority of these can avoid any surgical or major medical intervention. All it takes is just a little bit of conservative care with good rehab or an exercise plan, and sometimes just even the natural progression of time. And we know this just based on a lot of the recent publications that have came out over the years. A lot of discs can actually resolve on themselves. We've actually found out as well. We want to avoid getting imaging right off the bat if we can, unless we feel like it is an emergent situation. And then that's something that you're going to consult your doctor with, if that is the case. Reason being is this can sometimes actually prolong your recovery and throw your outcome a little bit further out. Sometimes even as long as like 120 days longer compared to most people who don't. So let's go ahead and take a couple exercises that you can get started on now and start working your way back. So for the first thing, I feel like it's pretty necessary to talk about what's a hip hinge, okay? When we're in kind of this acute state, it's hard for us to bend our back, right? That's why we may be wearing like a low back brace. I would suggest finding one that not only Velcros in the front, but then has two sides that can kind of tighten that up. And you're gonna want that to cross over the area of where you're feeling the pain the most, okay? Like I said, this is when we're bending over. The hip hinge, however, kind of teaches us to do that ourselves. So we want to kind of wean ourselves off of that low back brace as we start to feel improvement. Best way to do that, take a broomstick, you're going to put it behind your head, you're going to go head, mid-back, and then right around your pelvis area. I'm going to go here, and then the main thing is you're going to notice that my hips are pushing into that dowel or broomstick, and I'm bending over, okay? This allows me to feel more tension into my legs than in my back. It's kind of the point, right? So we're trying to get tension away from our back and distribute it elsewhere. So I'm here, I push into the dowel, and I can go down. Once you kind of get the hang of it, you can now go into the front and repeat the same movement here, okay? This looks a lot like what we would be doing later on in rehab where we're picking up weight. It's called a deadlift. Let's jump to this next exercise called the side bridge. So the next exercise is what we call a side bridge. I feel like the buzzword is core exercise, right? So this one is trying to work on what is the lateral portion of the core. It's mainly just working on building up stiffening around the torso, okay? So I'm going to stack my legs like so. I'm going to have my elbow underneath my shoulder, this shoulder in line with my hip, and then my hip in line with my ankle. So it's got like kind of a 45-degree angle bend in my knee, okay? I feel like a lot of people get kind of sloppy here, so I always say push the ground away from you as much as you can. That kind of creates this nice little triangle. And then from here, it's kind of like I'm getting up out of a chair. So it's not like a side plank in terms of coming up. It's actually a combination of up and forward. So I'm gonna bring myself to you, like so, okay? This is a nice kind of dialed back version of a side plank, but I would hold this for time, or you could also do this for reps as well. Again, movement is medicine, so the more we're kind of working through this to our tolerance level, the more you're going to notice, the better you're feeling, okay? Give these a shot, and if you'd like to come see us, we'd love to help.